It looks like most of those who have been infected were unvaccinated, and the outbreak area has one of the highest vaccination exemption rates in the state. How concerned are you, though, that this could spread?
Very concerned. I think this will spread. There's been 100 cases that have been identified so far. There's probably many more than that. So I think that this is going to get into the hundreds of cases and could take many months to try to fully snuff out. And when you have that kind of a concentration of measles within a community, it's going to inevitably spread outside that community. When you look around the country, there's a lot of parts of the country, states that have relatively low vaccination rates when it comes to MMR right now. You look at Idaho, about 80% of children have been vaccinated for MMR. Alaska and Wisconsin are about at 84%, Minnesota 87%, states like Florida, Colorado, Oklahoma, Georgia, Utah are around 88%. Iowa, I think, is at 89%, and herd immunity is achieved at a vaccination rate of between 93 and 95%. And even within those states, it's not like the low vaccination rates are distributed evenly across the states. There's pockets of under-vaccination. There's communities that have relatively low vaccination rates. And so when you have this much virus spreading in that portion of Texas and New Mexico, I think that there's some inevitability that you're going to see cases exported into those other states where there's low vaccination rates, and you could see a continuous spread across the country. Even at a low level, we could get some endemic spread. And the risk to the United States right now is that a virus that has been largely extinguished from circulation in the U.S. could return and just continue to spread even at a low level. And the U.S. could be at risk of losing its measles elimination status, which would have more profound implications on things like travel advisories that could be initiated from other countries. And so beyond just the public health impact of this, which I think is quite substantial, there could be some economic impacts as well. And finally, when you look at that outbreak in Texas, 27% of people have been hospitalized, and there's been 4 cases where children have contracted measles that have been vaccinated. So those were probably kids who only had 1 dose of the vaccine. But there's a lot of people who are at risk of this beyond just the people who have chosen to forego the vaccine.
That's terrifying, doctor. And kids are usually vaccinated, as any parent knows, around 1 year old, roughly.